I would like to discuss the ethical issue of end-of-life care in relationship to adolescent patients with chronic illnesses. This is a very difficult issue for both the parent and the patient to face and must be handled with care. According to the article, The Key Factors Affecting Dying Children and Their Families, which was published in the Journal of Palliative Medicine by Hines and Baker, both parents and healthcare providers report lingering anguish if the child experienced any observed suffering. The dilemma is how a nurse can help the patient and family when the end of life is near. Particularly, this is a problem in a case where the adolescent wants no further interventions and the family wants everything possible done. These are the options. The first option is the patient makes all of the decisions. This may occur if the family's in denial and do not want to deal with any of the choices that need to be made related to the end of life. Number two, the family makes all of the decisions. This would be in the case that the family is experiencing so much pain and difficulty dealing with the situation that they just take complete control of it and don't consider the patient's feelings at all. Number three would be the choice of the patient and family coming to terms with the end of life, making informed decisions based on the information that's provided to them. Let's look at number one. If the patient, who is a teenager, makes all the decisions and the family allows this to happen, there will be feelings of anger and guilt left over after the patient dies. Number two, if the family makes all of the decisions, there's no communication with the patient, their feelings are not considered, and they have a lack of dignity and respect with their death, and they feel like the experience is completely out of their control. Number three, this would be the best choice because it increases communication between the patient and family. They have to have this conversation of, what each member would prefer. You can facilitate this by bringing in other disciplines such as the physician, the social worker, the clergy, child life specialist, anyone that you feel can increase the patient and the family's understanding of what's about to happen and determine what their choices are. As nurses, we must promote the patient's autonomy. Even though the patient is a minor, they still should have some say-so in what is happening to them. They should still have a feeling of control and dignity. This is what we must find the most important and what we must focus on no matter what our personal feelings are in this situation.